Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Parimala Devi. She is a renowned gynecologist, obstetrician, and she is a colpologist and robotic surgeon. More than that, she has set a world record, that to Guinness World Record, in screening the CA cervix patients. And recently she's been taking part in inoculation, that is giving the vaccine for the CS cervix prevention also. And today she's going to talk about the urinary tract infection, because this is one infection which is neglected by the people. So welcome, Dr. Parimala Devi. Please explain to our viewers what is this urinary tract infection and how it occurs and how to prevent it.
Pranams, madam. It is my real opportunity to speak to the people along with you, because you are a epitome of big knowledge in every field, we can say, whether it is spiritual, nutrition, or any other field, hygiene. So, with you discussing about urinary tract infection in women is something like a very important topic, I can say, because urinary tract infection is one of the commonest problem women will come at any age, especially the age between the 20 to 40 years. Lot of people come with urinary tract infection. So today I would like to give my respectful pranams to you and start this matter to the best extent in this time, because urinary tract infection, when a woman visits us, first of all, if there is a young girl, we have to look into that she is school going, and she is actually, if she has started getting into the menarche phase, she is very new to that. She doesn't know how to take care of herself, even though the parents might have taught her. But in
Including
the
changing
school,
the pads and
yes,
cleaning the
yes,
part during
yes,
the menstruation. Yes.
yes. In the
And
school
blood,
again,
blood is like a blood agar. Whenever there
yes,
is a blood accumulated for many hours, the
hours.
bacteria will grow in
Correct,
that,
correct,
like
correct.
how we
It's a
grow. Yes.
great culture media for the bacteria to grow.
Correct.
So,
Absolutely.
and the school girls, poor thing, like morning when they start going, that time they wear the pad, and there will be class after class, and they may not have the opportunity to go and
To
change and
change
all.
also.
And
Yes.
it is that tender age that they are so shameful about their menstruation. Many a times they want to hide it. Like, these are all some emotional problems also. Even though of late they are trying to understand, and even the school teachers, everybody is cooperating with their emotions, but still we have to educate them, because they may get into this urinary tract infection, because as you said, the menstruation is a good culture for the bacteria.
Correct.
Usually menstruation also has some bacteria. Those bacteria may enter the urethra, that urinary passage,
Which is very
and may
close
lead
by.
into urinary tract infection, because the pad what they are using from morning to evening may cause lot of some sore part in the urethra
Abrasion.
also,
Yes.
because they are walking, going class to class, and they may be having the PT period where we have to play, do the drill. So many untold things from the child will have to listen, and we'll have to make them that they have to be very much taking another pad. Or these days we are actually hygiene cups have come. People are getting understood about the cups, because once you put the cup, the whole day they will not have so much of disturbance. So all these things we have to make them understand, and the parents also will have to make more healthy by not getting the urinary tract infection, because this is the age like they have so much of pain in the abdomen, uterus is growing. So along with that, if urinary tract infection means, they'll become really too much panic for their situation.
Yeah.
By
And
living above
especially
this,
the pregnant women, if they get the
yes,
urinary tract infection,
yes,
it is a
yes,
question of two lives. The
yes,
same bacteria, the bacteria carrying blood, enters the
yes,
baby's blood also. And as
correct,
a result, the baby also gets infection. And
correct,
that's how they have to be very careful.
yes.
And
So in
especially if they're diabetics or hypertensives. Yeah, please.
yes. In pregnant ladies, what happens? Usually, baby is growing. Because of that, usually the urethra also becomes more like
Short.
lifted and soft. And because of the hormonal influence, it becomes more soft and open. So
Right.
the bacteria can enter more easily in the
Very
pregnant lady,
easily. Yes.
very
Okay.
easily. So because of that, the pregnant ladies coming with urinary tract infection is very common most of times. And that time you will have to tell them, especially in the first 3 months when they come for their first reporting of the pregnancy, we have to tell, you may have urinary tract infection. Don't compromise on drinking water. Please see that you are hygienically, you visit some bathrooms. Don't carelessly go wherever you are going.
And now
Any
you have
bathroom.
the what to say, like a toilet
Yes,
antiseptic spray also.
spray
If you are
also.
using, yeah, if
Such things, and there are
yeah,
some toilet covers also available these days. If it is
yes,
so much, like they have to go, they have gone somewhere for a temple or somewhere little far away. That time the toilet covers, disposable toilet covers, they can always carry and use it over this one, and so that they can protect to some majority
yes,
extent from the
yes.
infection, because the public
The
toilets are the one, like people are.
flush the toilet first before you sit, or
Yes,
don't
that is
sit.
also.
Yeah, that's
That is
also
also. There
important.
is, of course, if at all I go to tell, even though not commonly followed, the squat position also is used by some people so that they will not touch the flesh part of the
Come on.
outer
Yeah,
rim. These are
yes,
all few things, but that's what, if they are conscious that, oh, these are the places we are going to get urinary tract infection. If they know that, then definitely they can protect to some extent.
yes.
Because this pregnancy is a condition where the urethra has become soft, the canal is open and more inviting the bacteria,
Mm.
and it is sometimes the infection between the couples because of
Okay.
the sexual contact.
But the
So
husband infection will be transmitted to the wife.
yes, yes.
Yes.
So we will have to see that the urine, which examination, what we do, microscopy or culture,
Mm.
both of them we have to ask them to do. Because we
Yeah.
feed the
Okay.
pregnant lady, we give them and they become all right. But again, if at all they copulate, then suddenly the infection may increase. So again
Yeah.
and again, urinary tract infection in a pregnant woman, you told just now.
Mm.
I think from you we have heard about that endocarditis and the pus formation.
Yes.
One,
What happens is, whenever the urinary tract infection is severe, they'll have the bacteremia. That is that bacteria
yes,
will be circulating in the blood. So that blood through the placenta goes to the baby. So
correct.
it is to the right side, and the right
Yes,
sided tricuspid valve will have the infection. And I have
yes,
seen the premature babies born
yes,
to the ladies who had a urinary tract infection in the last 3 months, and they will have the vegetation and tricuspid regurgitation, and the child can have the failure also. And that's how it is very important that not only the mother, the child also will have to be treated. And the
yes,
premature baby, on top of that
yes. So
septicemia,
many
and
problems.
on top of that vegetation, all that, saving the life becomes very difficult.
Very,
Yes.
very risky. So,
Mm.
and the baby's morbidity also increases. Premature
Yes.
babies are very small,
Yes.
actually. Their weight
Yes.
is not
Yes.
good to, immunity power
Yes.
is not there. So,
Correct.
other than this, in pregnant ladies, another thing what happens, sometimes they may be diabetic,
Mm.
sometimes they may be very obese. So,
Yes.
all these things, they, especially the sugar in the body is a good culture media for the bacteria to grow.
Correct.
So, these
Yes.
are few things that we have to give attention, and we have to see that, and we have to instruct them not to take any medicine off the counter without
Mm.
consulting a doctor, because these medicines may have some detrimental effect on the baby also. So
Yes.
not to
Yes.
take erratically any medicine what they get, they have
Very
to
important.
always hydrate
Very
themselves
important.
properly.
Yes.
Hydration, they have to take care, and they have to see that the hygiene is maintained. And anyway, they don't have the menstruation now, but these things of hygiene, everything have to be maintained along with the doctor's whatever the
And
suggestion.
one more thing, Parimala Devi, when they are pregnant, the frequency for urine increases.
Yes,
But that
yes,
should not be mistaken for anything. If they think that
correct.
if there is a urinary tract infection, also they have the frequency.
Yes, yes,
But there
yes.
it will be painful one. It is a
Painful,
dysuria.
dysuria.
It will be
Hmm.
very severely burning. And then, they should not take, they drank soda, or they take some
Yes. Their
kashaya.
own
No,
treatment.
they
Hmm.
no, they should not do that. They should come to doctor, get their urine examined. And here you make only the wife or the husband also get the urine culture.
Urine culture they have to do.
Mm.
And they have to be told that, because they have a silent infection. Usually male will have silent infection because it's a long urethra. The
Mm.
infection will be almost persisting once it comes. It will
Mm.
not get clear so easily like a female patient.
Mm.
So we have to tell them that the hygiene of the penile organ is very important.
Mm.
And we have to tell that
Mm.
they also have to get their urine tested, and
Mm.
they have to follow what is called a safe sex by using the condom method during the intercourse. And
Mm.
another thing, sometimes women may come with horrified with that, oh, we are passing blood in the urine,
Mm.
hematuria. That is
Hematuria,
because
correct.
they have not taken enough water only, enough
Mm.
water. And
Mm.
some infection may be there. Suddenly they may exhibit themselves thinking that
Yeah,
they are
but
passing blood in the
hematuria is very, very serious
important.
matter. It
Yes.
may be from the urethra, it may be from the bladder, cystitis, or it may be from the kidney itself.
Pyelonephron.
Yeah.
From the
But
upper
if
part.
it is from kidney, it will be silent, not painful.
Yes.
But if it is from urethra or the bladder, they'll have the severe burning and the pain.
Burning sensation.
So,
Yes.
yeah. So they have
Burning
to come to the
sensation.
doctor. Yes.
Yes. In that condition, they may have chills, fever.
Yes.
Like how in the malaria,
Chills and
there will be a lot of
rigors,
rigors and this one, like that only they may have that shivering and fever, everything. So urinary tract infection is not a simple thing. It's nearly about 80% in our population. Because of so much of populous country, the bathrooms available are also crowded, and it is sometimes the ignorance. All these things make our urinary tract infection more and more. And they have to take a proper analgesics and antibiotics according to the doctor's prescription. And even male partner also, husband also have to be
has to be
treated
treated.
equally, and they both have to follow a lot of hygiene measures. This is one thing.
Correct.
Because as you said, it is not only the mother, the baby also will suffer in this
Yes.
age group.
So,
The another age group is the elderly age group, where they have their immunity less and their hormone power. Women are losing their estrogen, hypoestrogenemia. Because of that, their urethra becomes atrophic. I have seen women coming with a total retention of urine. They could not pass urine. They
the
think
bladder
that
is full.
something has happened
Okay.
to our kidney because of some hypertension or anything. They think like that. But go to see, the urethra will be totally atrophic.
Oh.
Our lower urinary tract field is so much dependent on this estrogen hormone. The atrophy of the vagina happens, atrophy of the urinary tract happens, and atrophy of the labia majora, the skin also happens in elderly women. In those cases, and if they are diabetic, because they are in the elderly age group, if they are diabetic and all, the urinary infection is something extremes. Sometimes they will have to undergo all the investigations thinking that there is something. We sometimes do a procedure called just a simple dilatation under sedation. When we dilate the urethra after around 50, 55 years, if they come like that, then they become totally all right. Their urinary tract infection. These are some few rare cases, but how a menopause can affect our elderly women.
Yes.
And immunity is
The
coming down.
hormones can give benefit to the women, and deficiency can make their health worse. Yes.
It can give the happiness also, it can give the tragedy part of the life also, the hormones. So elderly women are different category and they have to be taken care. Sometimes some creams are also given around the urethra. They can apply it daily 2 times. That time, thus epithelial cells again they will start regenerating. Because of that, urinary tract infection comes down. But what for it is infection, we have to do a urinary microscopy test. We have to see in that any pus cells are there, epithelial cells are there, any some crystals are there.
RBCs are there.
RBCs are there because stones are also sometimes broken and they come in the urine. Because of that, some small stone may block the urethra. That also can give rise to a lot of problems. So these few awareness is very important in our women, that be very hygienic and be always aware like what can cause your urinary tract infection, especially when you are on a tour or some temple tour or something. See that your hygiene is taken care there also. And in married people, it is always husband and wife both have to be treated. Both have to understand the hygiene because their baby is not really subjected for any problem. So like this, there are a lot of this one, but they have to understand depending on the age group. And as you said, menstruation itself is a big media for the bacteria to grow. Especially in the, if she is not pregnant, she is menstruating and getting the urinary tract infection, then it may be the hygiene part only may be troubling her. So some of these important things should be taken care, and women have to be healthy because urinary tract infection, once it is neglected, it can cost your kidney also. So kidney, it is something a very sensitive organ. If there is some damage to the kidney,
important, and then damage can lead to the dialysis in the future. So thank you. Thank you very much, Dr. Parimala Devi. You have explained so much and stressed on the importance of treating both husband and wife and the cleanliness. Thank you very much.
Thank you, madam.